So what are the types of facial paralysis? In general, I consider there to be three types of facial paralysis. You can have flaccid facial paralysis. That's like what people think of when they think of a facial droop. Things are collapsed. The oral commissure is down. The eye is wide open. It's flaccid. There's no input to those muscles. On the flip side of that is hypertonic or synkinetic facial paralysis. We often call that non-flaccid facial paralysis, or NFFP. And that is the situation in which all of the facial musculature essentially has too much, but somewhat misguided input. Those are people who have a hypertonic nasolabial fold. It's too prominent in here. Their eye is too narrow. They have pain syndromes throughout. You can see some of the muscle bulging when it shouldn't be. And the third flavor of facial paralysis is what we call a mixed picture. A mixed picture is when there are elements of flaccidity and hypertonicity. And usually we see that mixed picture either when somebody is evolving, in other words, going from flaccid to a hypertonic state, but they haven't really achieved that hypertonic state yet, or if there's a strange etiology for the facial paralysis, like a facial nerve tumor. So whenever I see a mixed picture, I assure myself that either that face is in evolution or that I investigate for the possibility of a facial nerve tumor.